Hello, welcome to my YouTube channel. I'm Dr. Hassan. So, guys, today I'm going to discuss an important topic, which is first video of this series. In this video, I'm going to discuss Simman journal approach, and it's important exam for Plab 2, Ukmla, or also if you are going to give your ALS or EALS, this is important video for you. So this journal approach I have made for you guys, and by using this approach, I have got 12 out of 12 in my Simman station in my Plab 2 exam, and I also cleared my ALS exams by UK Registration Council by using this approach. And this is most widely using approach, and this is so simple. By using this journal approach, you can never skip any important part in your station or exam. So without wasting any time, let's start. And this is most authentic uh, approach I have collected after having research on different authentic websites. So let's start. There are five points for journal approach. Today we are going to discuss just journal approach, in which there are 5 or 6 points. Okay, so what you're actually going to do is that you will have to watch the video till end just for having good understanding of the journal approach. So first of all, introduction. Whenever you enter in the exam room, usually the Simman is station is to assess working in accident and emergency or in acute condition. So what you have to do is that whenever you enter in the room, that you will have to loudly say, "My name is Dr. This and my GMC number." Your identity you should have to verbalize loudly. Okay. After this important point, that important point, this point is very important. Assume I have taken all universal precaution, which majority of the students or doctors skipped. If you say, assume I have taken all universal precautions, which means that you have wearing aprons, gloves just before start of your examination and consultation with the patient. So the examiner will see that you are safe, doctor, that you you verbalize that you have taken all the universal precautions. Okay, so what you have to do, you have to write loudly, just verbalize that I assume I have taken all the universal precautions. Then you will have to move to the patient, which lie on the bed or somewhere else. Okay, so you will have to greet the patient. Hello, I'm Dr. Robert. I'm one of the doctors in accident and emergency or in this department. Okay. Then if you know the patient's name before before entering the room, then you can say that, am I talking to Robert or am I talking to Margaret? Can I confirm your age? Or you can say that, may I confirm your name and age? Just whatever you think that works for you, it's okay. So after that, what you have to do is that you will have to confirm the identity of the patient, which is most important. Okay, most of the doctors just skip this point. So identity of patient is most important thing. At third point, what you have to do is that acknowledgement is most important. Just to say that what actually you see, you will have to verbalize. You have to tell to the patient, I can see that you are in pain or difficulty in breathing or vomiting. So this is actually acknowledgement, which is most beneficial for your marks. Okay, so what actually you should, and also in patient's perspective, it is important that that the patient will think that you acknowledge you and you verbalize it. Okay, then you say, I am here to help out you. Okay, first thing is introduction. Second thing is greeting. Go to the patient and say that I am Dr. Robert, and in this accident emergency, may I confirm your name, and then acknowledge what actually patient is going through. If you see, you have to verbalize it. This is called acknowledge. Okay. So just after acknowledgement, you have to say that, can you please tell me more about this open question? Okay, then these 5 or 6 questions is most important. When did it start? How did it start? Is this first time that you are having this pain? Have you taken any medication, any past medical condition, any allergy or any other medication? Okay, and then thanks your patient for answering the question. Why this is important? Because if patient has a pain, might be he took some medication 10 minutes ago, half an hour ago, okay, and if he has some um like if he has any breathing difficulty, might be this is first time after having receiving some antibiotic or some any other infusion. Okay, so this is most important questions you will have to remember on fingertips, and you will have to make reflexes on these questions. Okay, so after asking the question, just thanks your patient, always thanks your patient for answering the question. Thank you so much for answering my questions. Or you can say that, thank you for answering all of my questions. Now, Mr. Robert, uh, now the fourth step, which is assessment A to E, which you will have to tell to your patient that you are gonna examine a different part of body, which might be uncover, need to uncover, and all the assessment you will have to verbalize. That you will have to tell the patient that it includes looking, touching, tapping, and listening different part of your body, and I need to get uncover different part of your body. So it is signpost that you're gonna tell patient that I'm going to do these things. Okay, all right. So basically it is A to E approach. So you will have to uncover his chest, uncover his abdomen, to look at his private part. Okay, and the fifth point is chaperone, which is most important. Most of the doctor also forget to mention this, and they get fail in the exam because of the chaperone thing. It's most important thing to maintain privacy of patient and for your safety as well. So you will have to apply. I have a chaperone along with me to maintain your privacy. Okay, so this is most important thing. You don't have to forget this point. And the last point is consent. Okay, after after telling the patient that everything about the examination, A to age assessment, about uncover different part of body, you will have to take consent before proceeding, before touching the patient. Okay, at the end you will have to tell that, would that be okay? Should I start examination? Should I start now? Would that be all right? You can use anything that whatever suits you. So after this point, you will see that I can see my patient is attached to cardiac monitor. Just verbalize this, okay? Because in Simman station, most of the patient, like 100% of the patients are usually attached with cardiac monitor, and there might be some readings on cardiac monitor regarding saturation, blood pressure, pulse, respiratory rate. So just you can say that I can see my patient is just attached to cardiac monitor. So you just have to look at the monitor. Okay, you don't need to dramatize that I'm going to attach with cardiac monitor and this and that. This will what actually this will wastage of time, and it's better that you just say that my patient is attached to cardiac monitor, and I'm going to just look at the vitals. And you can see if patient is having breathing difficulty, you have to focus on saturation. If patient is having dizziness, uh, you will have to check for blood pressure. So in next videos, I'm going to discuss A to E assessment in detail, and till then, after A to E assessment videos, we will start one by one on different topics, airway, airway topics, breathing topics, and so on. So if you have any questions, you can leave a message or drop a comment on comment box. And if you don't, if you didn't subscribe my channel, please subscribe and share with your friends, and for further useful videos on Plab and the topics. Thank you.